Welcome to Shri Ram Medical College. Today we will explore Unlock your potential as a nurse with Shri Ram Medical College nursing course. Can you lift others up while they're feeling down? When someone is harmed or has an accident, do you know what to do? How well do you think you would do if you were in charge of the treatment of the sick and injured? As a nurse, it is your responsibility to assist patients and victims of accidents and illnesses. You will be responsible for ensuring that all of your patients strictly adhere to their doctor's orders. It's vital to be there for patients and their loved ones as they heal and grieve. Without nurses, the healthcare system would fail. It's tough to picture our healthcare system operating in the midst of this pandemic without dedicated nurses. The duties of a nurse go much beyond those of a conventional physician or surgeon. They give care and medical assistance in so many different ways that it's hard to lump them all into a single category. If you're a nurse, you help people who are sick or hurt. It is crucial to assist patients and their loved ones as they go through the healing and mourning processes. The Shri Ram Medical College of Nursing offers m/gnm/b.sc.nursing/postbasic p.sc.nursing/m.sc.nursing programs. Continual education and training provide professionals with the tools they need to adapt to the dynamic nature of today's healthcare system. Professionals can prosper in today's complex healthcare system by acquiring the knowledge, attitudes, and abilities that are taught in continuing professional development (CPD) courses. This opportunity arises as a result of subjecting one's work to the scrutiny it merits and accepting the obligations of a competent clinical practitioner. Nurses are expected to check in with their patients at regular intervals and administer any necessary medications. They do more than just help doctors and nurses set up shop by supplying essential resources. Nurses also help those who are unable to care for themselves due to disease or disability. In addition to these general responsibilities, nurses also have the option of specializing in midwifery, cardiac care, intensive care, orthopedics, pediatrics, and so on. Nurses can only conduct their work properly if they have access to state-of-the-art medical equipment. There is an emphasis on the use of evidence and cutting-edge technology in the various modules of the program, which are then applied to clinical practice, leadership, teaching, and/or management. Minimum education eligibility criteria for admission: 12th class with 50% from any recognized board. Students above 17 years of age can apply. 5% relaxation for SC/ST candidates. Nurses determine treatment plans after carefully assessing each patient's condition. Nurse keep to the prescribed therapeutic schedule with great diligence. Nurse rapidly administer all prescribed drugs and intravenous fluids to the patient. Nurse takes samples from the patient in addition to measuring their temperature, blood pressure, and heart rate. Our patient has to immediately begin receiving a steady stream of fluids via a drip, transfusion, or saline solution. Nurse respond promptly to patient needs and assist the attending physician. Nurse assist doctors in caring for patients before and after surgery. Nurse collect vital signs, document them, and call in any red flags to the on-call physician. Nurse duties include taking down and filing patients' medical histories. Nurse comfort patients and their loved ones with words of reassurance and understanding from the medical community. Nurse facilitate and manage the work of other healthcare professionals. When nurses practice professionally, they uphold norms developed jointly by the nursing, medical, and treatment communities. Nursing professionals are responsible for maintaining a risk-free workplace by strictly adhering to all applicable safety regulations at all times. Nurses stay on the cutting edge of medical practice and technology by taking advantage of continuing education options and reading specialized professional journals. A registered nurse in India has a variety of options for employment, including the Indian Red Cross Society, the Indian Nursing Council, individual state nursing councils, and others. Nurses with an M degree work as primary healthcare providers and midwives in primary healthcare clinics across the country. Nurses can find administration and teaching positions in colleges and schools dedicated to the nursing profession. The opportunities available to the innovative person in today's economy are greater than ever before. This includes the possibility of opening one's own nursing bureau or negotiating one's own working hours and circumstances. Entry-level registered nurses in India might earn anything from Rs 10,000 to Rs 17,000 Indian rupees per month. The annual salary of a registered nurse in India can range from Rs 48,000 to 60,000 rupees. Switching to a higher-paying specialty or moving to the US, Canada, the UK, or the Gulf states can help nurses earn more each month. Shri Ram Medical College offers m/GNM/B.SC.Nursing/post-basic B.SC.Nursing/M.SC.Nursing programs. As the population grows and new cutting-edge hospitals are built, qualified nurses will be needed. Unfortunately, the supply of nurses has not increased to meet the rising demand. Recent estimates place the number of nurses who are part of the Nursing Council at around 19.8 million worldwide. However, only 4 lakh nurses are now working at hospital. A growing population means an increased demand for nurses, who should expect a healthy job market. There are currently a growing number of medical facilities available to the public. There is a significant demand from other countries for trained nurses. India is rapidly becoming the world leader in the exportation of nurses to developing countries. Licensed Indian nurses may feel compelled to leave the country in search of better pay and working circumstances. 60% of registered nurses work in hospitals, 18% in ambulance/mobile clinics, 7% in home healthcare, 5% in the military, and 3% in Ram medical colleges M/GNM, B.SC.Nursing/post-basic B.SC.Nursing/M.SC nursing programs. Take the first step toward a successful career as staff nurse in government and private hospitals across India and abroad. We are here to assist you in launching your medical career. Call us at 9968193009 for more information about our program or to submit an application right away. Shri Ram Medical College, nurturing next generation of healthcare leaders, and offers all paramedical, pharmacy, nursing and yoga sciences courses at competitive fee and helps in 100% placement assistance. Admission open. For more information, please visit our website shriramcollege.com and like, share, subscribe our YouTube channel Shri Ram Medical College. Good luck, goodbye.